So there's another type of fat that circulates in our body. Is called triglyceride, or the VLDL. There are also other types of particles that carry triglyceride. The LDL particle contains only a small amount of triglyceride. The other particles like the VLDL and chylomicrons are loaded with triglyceride. So people with diabetes, when they have poor control of diabetes, they often have high triglycerides, a common phenomenon. Triglyceride is a very different fat than the LDL cholesterol that we just talked about. While it's very important to lower LDL cholesterol with the use of statins, the statins are not very effective in lowering triglycerides. The best way to lower triglyceride is actually blood sugar control, which does not improve LDL cholesterol that much, but it actually is a very important determinant of high triglycerides. The other thing that have a major influence on lowering triglyceride are body weight. In other words, if you're overweight or obese, even modest weight loss of 10 to 15 pounds will cause a significant reduction in triglyceride level. And finally, exercise. Even if you are not able to lose much weight, if you exercise regularly, you can lower triglyceride quite effectively. So in order to lower triglyceride, the strategy is quite different. Here, the blood sugar control, exercise, and weight reduction are three most important components of management. Low level of HDL cholesterol is a risk factor for cardiovascular disease. We have known it for many years that people who have low HDL cholesterol are relatively at higher risk of developing cardiovascular disease. Even though we don't have clear guidelines for raising HDL cholesterol with any particular drug, because the drugs are not necessarily effective in raising HDL cholesterol, the best way to raise HDL cholesterol is actually regular exercise and weight reduction, and also diabetes control, almost the similar strategy as the one for lowering triglyceride. In fact, if you lower triglyceride, subsequently you can see a rise in the HDL cholesterol because they go in the opposite direction. HDL cholesterol is also very heavily determined by our genes. So some people are born with low HDL cholesterol, very hard to raise it. Some people are born with high HDL cholesterol. But most important point to keep in mind is that if you have high LDL cholesterol, regardless of the HDL cholesterol, whether it's high or low, you still need to focus on lowering LDL cholesterol, which is the most important way to reduce the risk of cardiovascular disease. Whether raising the HDL cholesterol will reduce the risk of cardiovascular disease prospectively is not entirely clear, although we always recommend that if you can raise the HDL cholesterol with diet and exercise without medications, that's certainly welcome.